You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to. In the description below, you can find web links to all the websites, videos and resources that are mentioned during this video.
Welcome to section 3. In the last section, we looked at symptoms of type 2 diabetes. In this section, we will be talking about different factors which can increase our risk of developing type 2 diabetes. It does not mean that the person will definitely get type 2 diabetes. It just means the risk of getting type 2 diabetes is increased. Risk factor: ethnic origin. People of an African, Caribbean or South Asian ethnicity have an increased risk of developing type 2 diabetes. Risk factor: genetics. Having other family members, such as brothers, sisters, parents or grandparents with type 2 diabetes, gives that person an increased risk of developing type 2 diabetes. Risk factor: age. Just getting older increases the risk of developing type 2 diabetes. Risk factor: being overweight. Being overweight and having a larger waist size and carrying weight around the middle can increase the risk of getting type 2 diabetes. Risk factor: being less active. Being less active and having a lifestyle where there's more time sitting than standing up and moving can increase the risk of developing type 2 diabetes. Depression, long-term stress and anxiety can be another risk factor for developing type 2 diabetes. Oral steroid tablets or steroid injections, which can be necessary to treat other conditions, can increase the risk of type 2 diabetes because they can increase your blood sugar levels. Any damage to the pancreas, such as pancreatitis, can have an impact on the insulin production, which can increase the risk of getting type 2 diabetes. Gestational diabetes, otherwise known as diabetes in pregnancy, increases that person's risk of getting type 2 diabetes in the future. Also, a person who has polycystic ovarian syndrome, PCOS, has an increased risk of type 2 diabetes. Sometimes when people are diagnosed with type 2 diabetes, they may blame themselves for getting diabetes. But as we have discovered in this section, there are lots of risk factors that we have no control over. Once we have been diagnosed with type 2 diabetes, the way forward is to manage the condition and to try and keep our blood glucose within a healthy range. We will learn how to do this in the following sections. This concludes section 3, factors that can increase the risk of type 2 diabetes. In the next section, we will look at some of the potential long-term health effects of type 2 diabetes if blood glucose levels are not kept within target.